Okay, we'll do a quick tutorial here on priming and hanging secondary IV tubing. You may hear it termed as IV piggyback secondary tubing, kind of used interchangeably here. So the first thing I want to note that I didn't mention in the previous video is after connecting a primary line, we want to make sure we secure it with tape so that's not getting caught on anything and possibly tugging and removing our IV site here. So a secondary or piggyback IV infusion is something that can connect and infuse into the primary line here. With all medications, we want to verify our order. We want to perform our 3 checks, our 6 rights of medication administration, and gather our supplies. To hang a secondary IV set, we're going to need the secondary fluids, secondary tubing, alcohol swab, and a IV tubing label. You also might want to have a cap available as well if we're going to be disconnecting our IV fluids. So IV piggyback medications are most oftentimes intermittent antibiotics that are administered. We want to make sure that they are compatible with our primary fluids. If they are not compatible, we will have to infuse our secondary medications through a primary line. So that's something that we will go over in the Meditech lab, how to check to make sure that they are compatible. So we have all of our supplies here. Then we'll go ahead and hang the secondary fluids. Some things to note with antibiotics: they're generally stable for 24 hours once they are mixed. Some antibiotics will be mixed by pharmacy. Some the nurses will do on the nursing unit. First thing we're going to want to do is remove our secondary bag of fluids. Do that again, checking for intactness of the bag, checking for any cloudiness or discoloration of the fluid, making sure there's no leaks, and again checking to make sure our expiration date is appropriate. We can hang that on the IV pole then. We will then do the same with our secondary IV tubing. We want to check for the expiration date, make sure that the bag is intact. When I remove the secondary tubing, you'll notice it's much shorter than our primary line and does not have any medication ports attached to it. And it also comes with a hook that will be connected to our IV pole. The reason it comes with the hook is that we want to make sure that our primary line is hanging below our secondary IV solution so that the secondary solution can be infused by gravity. So we will remove our primary solution, connect it to our hook here, and we always want to make sure our secondary IV solution is hanging above our primary solution. So with our secondary tubing, you'll notice it's much shorter. Same thing. Remember, the first thing you want to do when removing it from the packaging is to adjust your roller clamp to the closed position. From here, I'll remove my protective cap on the spike, making sure we do not contaminate the spike in any way. Secondary bag is similar to our primary bag. We have the medication injection port and then the port where we will inject our spike. Make sure we grab that with our non-dominant hand, inject our spike with a little bit of force. And then again, we want to prime slowly so that we do not have any bubbles within the tubing here. So I will slowly adjust my roll. Whoops, before I do that, I want to make sure I fill the drip chamber. And again, no more than 1/2 to 2/3 full. We do not want the drip chamber completely full, so about right there. And then we can prime our secondary tubing. Adjusting the roller clamp slowly so that we do not have any unwanted air bubbles. I like to hold it over a trash can just so we aren't making a mess, losing any fluids. As you can see, it's going down slowly. And then we close our roller clamp. Then again, making sure we try to avoid contaminating the end of our tubing here. We'll take an alcohol swab, and when we are connecting to primary tubing, we want to make sure we go to the medication port, the first medication port on the primary tubing. And we want to make sure that is above the IV pump so that we are administering at the correct rate. So I will perform my alcohol swab, and we'll imagine that was 15 seconds. We will connect to our primary tubing, making sure we are still clamped here. And then we will go to our pump to program. So what we want to do is select our appropriate channel. So I will click Channel Select. You'll notice it has our primary infusion rate of 125 milliliters an hour, our volume to be infused. Down below that, we have the option for a secondary infusion.